So good afternoon and welcome everyone. My name is Shawn Rubin and I'm a licensed clinical psychologist here in Virginia. And it's a pleasure to be with you today to discuss applications of humanistic psychology in the provision of affirming therapy with transgender people across the lifespan. And I'd like to start with some gratitude. I'd like to thank the CE Committee of Division 32 of the APA, Humanistic Psychology. I'd like to thank Drs. Vanessa Brown and Roxanne Christensen, and they have an additional support here today. I'm sorry I didn't catch your name, but thank you very much. Grateful for all your support and help. And thank you all for coming. And I'd like to enjoin you all to consider this. There'll certainly be a lot of information that I've been fortunate enough to glean over the last 8 years. I'll be speaking some of the actual words and phenomenological experiences of the transgender and non-binary folks that I serve. And there'll be memes, there'll be little chats. I want plenty of time for your questions as well. So I certainly hope that we'll be able to dialogue throughout. So I will pause periodically to join in the community conversation here. And so I'd be curious to know, as you think about your own work, how are you serving the transgender population and communities? And if not, you'll have some real kind of concrete and clear directives, tips, invitations on how you can make your practice more affirming, more accessible, and work with a very targeted and oppressed population. And psychology psychologists and psychology itself has a huge role it can play in the health and well-being of the community. Okay. So I kind of want to set the sense of urgency here, that as many of you know, there are existential threats, and that is not a cliche term. Existential threats to the very existence and well-being of transgender and gender expansive folks. As we see bullying, violence, murder. There's a Transgender Day of Remembrance every year for those folks whose families do not grieve them, but their communities do. We see discrimination throughout the education system, employment, and housing. In terms of establishing the urgency, a survey a few years ago, one of the first comprehensive surveys done, estimated that there were 700,000 transgender folks in America. And then the next year's survey, they doubled that to 1.4 million. And now most up-to-date estimates are closer to 2 million. And here in the DMV, it turns out that it's about 2.8% of the population identifies as trans and gender expansive. And so the more awareness, the more consciousness, the more social cultural evolution and development we have, there's more backlash. There are hate measures brought upon by oppressive religious institutions and political institutions, most namely, of course, the Republican Party are the ones advancing all of these absolutely evil and destructive and annihilating attempts to legislate trans people out of existence. And so this is where our fight starts, and this is where we will continue. And this is where I invite others to join the fight and the struggle there as well. For all the folks who say how much they care about children and teenagers, well, if children and teenagers are not accepted, are not supported to emerge into their true gender self, their authentic self, we know that the experience of gender dysphoria, the incongruence of their assigned sex at birth, and their personal, innermost felt sense of who they are, their identity. We know that the levels of depression and anxiety, self-harm, and suicide attempts are 6 to 8 times the average, 6 to 8 times. And as the folks I've worked with have told me, every trans person has thought about killing themselves and considered it. And the level of discrimination experienced throughout all our institutions make it that trans folks are unable to be full citizens and participants and contributors to society. So this is a grave injustice, and we're going to talk about ways to meet that. Okay. Okay. Huh. think I might need some tech support for just a second here. Oh, there we go. Okay. First time doing this kind of setup. So thank you for your patience and bearing with me. So why am I here? I hope the information shared and discussed today offers you a glimpse into the world of transgender people and encourages you to develop proficiencies in your practice, such that eventually you would serve this population as well. And I am a cisgender white male. So a word about that. As I sit here with you, I certainly don't wish to erase the voice of any trans people or trans therapists whose experiences would be even more important for you to hear. I consider myself a therapist servant and hope to convey an empathic and respectful appreciation of what it means for folks in their experiences and what it means to be trans for them. I take the humanistic and existential approach that we'll talk about today, which starts with treating and thinking and understanding and appreciating the other with a sense of fascination and awe and care and support. And so that is a really important a lens and approach to which to appreciate transgender ways of being. Up until 10 years ago, I had not worked effectively with a transgender client. I had one client about 11 years ago who in retrospect over time revealed their gender dysphoria. And though I did not appreciate what she was telling me about it at the time, it didn't quite fit into the clinical and theoretical frameworks that I had at the time. I was ignorant, and I consulted with colleagues in my ignorance, and they very helpfully referred me to organizations who had expertise. And so I referred them to at time a wonderful LGBT organization called Affirmations in Ferndale, Michigan, where I was living, because this patient was seeking a letter for hormone replacement therapy. And I had not been prepared, didn't have the skills, wasn't sure what to make of it. And because she had initially been referred for depression, anxiety, and cross-dressing. So I likely failed her, though I attempted to put her with the right resources. And I have some guilt about that. I did not do more, couldn't do more at the time, excuse me. So perhaps part of my trying to do this, the better work now is driven and motivated by that kind of failure on my part. I was fortunate enough in my training to attend what was called the Center for Humanistic Studies, which was a radically person-centered and experiential graduate training, quasi-therapeutic in a way, focused on the growth of the learner and the researcher and the therapist. And where we started theoretically was trusting people and their experiences as the highest authority, that their inner sense of self and internal resources to guide themselves into more expansive ways of being and healing of growth. It started with valuing their experience as the highest authority. And that is a quote from Carl Rogers. And this was revelatory for me and for my fellow classmates. And then as I joined the faculty, hopefully for the students that I served for a decade there. Our research models were qualitative, again, respecting and exploring therapeutic interviews and collecting qualitative data. We often revealed experiences in our own personal lives and where we were struggling and how we grew. We used our own subjectivity throughout all the processes of graduate training in psychology. And we saw this as a gift into the depth and richness and understanding of ourselves and others. As researchers, we were stewards of the experience of the people we were interviewing, who shared their worlds with us, who shared their existence with us. And this kind of sacred responsibility for the experience of the other has always guided my work and that of my humanistic and existential colleagues, that we approach every person in therapy with reverence and mystery and openness and trust. And this has served me in the various populations I've worked with over the years, as I'll talk about in just a minute. And of course, we acknowledge this, our person-centered and relational existential theories, that if the right relational conditions can be established between two folks, that sufficient trust and safety can develop, our defenses and protections can soften a bit, and a reflective process of discovery can commence. And within this, we have recovered memories and life experiences, insights, integrations, and syntheses. And so I have found the existential and humanistic approaches so useful for so many people, whether it was children, adolescents, adults, couples, families, the LGBTQ communities, whether it's and now psychedelic research and therapy, the erotic spectrum. So it's been kind of validated over and again that this is a very powerful approach. I originally specialized in relationship play therapy with children as part of a Victims of Crime grant in Detroit, and created a play therapy program. And applying these approaches to these with these children seem to light up and open up. And again, it always felt like that kind of sacred privilege in an exploratory space. And we can see how this is exactly what targeted and oppressed folks who may be very suspicious of therapy, and rightfully so, because of stigma and because of harm done through our institutions. It can, over time, if trust is established, healing and growth can occur. As a self-reflective process really requires, it requires us to do our own work, right? I had to be careful of not coming off or believing myself to be the great white savior. I had the right way. That may have been communicating ways in which people had to respond to me. And that's the benefit of ongoing therapy or psychoanalysis and supervision and informal peer support. So I hope you'll always find that in your practice and avail yourself of that as well. It's one of the most important parts of my growth and development as a person and as a professional. So that kind of cultural humility, that kind of personal humility, we have to really embrace it because it allows so many important things to happen. And so I shifted then my work with predominantly African-American children in play therapy. I had several very educational and fruitful long-term cases with gay men who had not come out until their mid to late adulthoods. And I became sensitized to the awful long-term suffering of these men who had been closeted for decades, the isolation and depression and anxiety, the attempts to cope, and in some cases not be able to safely come out and live their authentic lives. Or in other cases, the process of emerging into their fullest selves, and how it changes their relationship to themselves, their family and friends, the larger community, their world, their sexuality, desire itself. So because I learned so much from this work, I was really sensitized to populations who have been oppressed for decades and in our country, centuries. I then moved to the Virginia area, and a colleague was retiring who was one of the foremost trans specialized therapists. And she knew of my work and we were colleagues, and she asked me to assume a stewardship of her practice as she was retiring. And so I was honored by the opportunity. And so what did I do? I did what every ethical psychologist would do. I had to get trained. And so I hired Dr. Michael Hendricks, who's a former president of Division 44, Gender Diversity and Sexual Orientation, and hired him as a mentor, a supervisor. He supervised my initial cases. And my colleague then introduced me in some of the support groups. So I started attending support groups as an observer who was invited. I began to then, and over time, I would then offer support groups with trans co-facilitators for children and adolescents and adults, either through PFLAG or through the Transgender Education Association. And so as I assumed this practice about 8 years ago, what emerged in the culture was that Caitlyn Jenner came out. And so millions of people have been watching the Kardashians. And so all of a sudden, across all sorts of socioeconomic, cultural backgrounds, religious backgrounds, people heard the word transgender and wondered what it was, or had reactions to it and began to do research. And so around that time, all of a sudden, more and more people who heard the word and maybe didn't quite have the languaging yet realized that that's me. Or that's someone I know, or I think that's me. And so a lot of questioning began to happen, a lot of emergence began to happen. And so I have a group of colleagues here who also specialize with the trans community. All of a sudden, we were working 6 days a week. And so for the last 8 years, I've been seeing folks nearly 6 days a week as we're hoping to train more and more trans therapists and gender expansive therapists as well, but to meet the present need. And so that is what I've spent the majority of the last 8 years focusing on. And as a result, then really being sensitized to the social cultural struggles, political struggles, the need for social justice and advocacy work, speaking at school board meetings and hearings, organizing with activists, supporting activists. I offer some pro bono groups for activists who are traumatized through direct actions or through burnout. So it's really become a mission. And so part of what I'll be talking about today is a way to share that with you. Another note is that some of you may have attended, be expecting to see the expert, Dr. Laura Dickey here today. And unfortunately, he was unable to attend. And so I'm kind of pinch hitting, not in any way I could never replace, but just to wanted to still offer some of the information because I think it's so important. But I made a personal decision not to be a presenter anymore of this work, to really step back and bring on folks from within the group, within the community, to share their stories, to share the information, and really center their voices. So that's been an important part of my personal journey, is to help center targeted and oppressed voices and take that step back and support and make sure that they have the stage. So a theme of my work the past several decades seems to be a desire to make the heroic attempts, which means that most of them will not work out well, maybe, but to serve and amplify the voices of people who, by virtue of their age or sexual orientation or gender identity, have been, again, targeted and oppressed. And so I'm now trying to use my power and privilege as a cishet white man to train and educate and affirm the existence of these groups and encourage students and colleagues to serve in this way. I'll just add another little theoretical contribution. An important part of my training was through the Michigan Psychoanalytic Institute and their child and adolescent psychoanalytic therapy, which was very contemporary. It was very, and so what it offered was these integrated theories of development. And it's something that if any students of mine are around will know that this is something I championed a lot during my faculty days, whether it was the original psychosexual theories, Ericksonian psychosocial, of course, attachment, separation, individuation, the temperamental work and goodness of fit work. So I think important, useful lenses and frameworks for thinking about how children, adolescents, and adults grow and develop. And so, and also how to work with parents in child cases. All this really helped in my work in working with children, adolescents, adults throughout the lifespan here. And they have some golden rules that I like as well. You know, the golden rule for the patient is say whatever comes to mind, right? Which sounds very simple. Those are very simple words, very difficult to do sometimes. And the golden rule for the therapist, very simple, no judgment. Right. So I found a very nice kind of integration, you know, it's very person-centered, very person-centric, let me say contemporary psychoanalytic approach is what I'm referring to. And of course, people following some of the news out of APA, Division 39, the Psychoanalytic Psychotherapy Division, has just offered an apology, a fairly substantive one, to take it, you know, for however apologies can be taken. What really matters is in the action, right, that follows through after the apology. But they apologize to the LGBTQ communities for the harm that their theories and approaches and applications have done over the last 100+ years. And so there's a reckoning that's happening right throughout American culture that needs to happen about how our institutions, our sciences have targeted and oppressed women, people of color, gender and sexual minorities, and so and our indigenous citizens. So the reckoning is happening in the sciences. It's got to happen throughout APA. A Truth and Reconciliation Commission should be appointed and worked through. And again, it's not just about acknowledgement, it's about the follow through. It's about the meaningful actions and changes that will come forward. And I think psychology has an important role to play in that as well. And again, as I think about my own kind of contributions, growing up Jewish in a non-Jewish area, experiencing transient anti-Semitism throughout my life. I was born with congenital anosmia, which means I was born without a sense of smell And so what I just in the last year or so taken to telling people is, well, I don't know what smell is. I've heard a lot about it, but I don't know what it is. And it was something, it's an invisible limitation that I could filter out of my everyday experience, but had some lingering impacts likely on how I experience myself and others in the world. And so these are some things that I think may have sensitized me and kind of stirred up my own empathic desire to connect and understand others. So there's a little more about what led me to becoming a therapist and what led me to working specifically with targeted and oppressed groups, hopefully in a culturally humble way. So let's see. So perhaps a solution or a compensation to attempt to know and heal myself and others. Hey, becoming a therapist, we do that, don't we? And so embracing that and looking at some of the potential harms that could be done in our attempts to do the good work, the unintentional or unintended consequences. Always have to be on the lookout for that. So there's a little bit about why I'm here. Okay. This advancing thing is I'll have to get into a rhythm here. Okay. So as we're talking about why are we here, it's a call to service, right? For all of us in different ways. This work reveals to me the challenging and urgent intersection of developing multicultural competency, right? Inclusion and accessibility in providing therapeutic services. This work requires us to work and interface collaboratively with medical professionals, social justice and political advocacy for LGBTQ people. It requires us to analyze and break the patriarchy, right? And to acknowledge our kind of neurotypical cisgender heteronormativity and explore the diversity of human experience, of being human, of human anatomy, of sex and sexual expression. And cis and cishet therapists have to approach it from the outside. And so this is where cultural humility and radical openness and listening can ensure that we do as good a job as we can do. So acknowledging oppression and discrimination, our intersectional identities can allow for the respectful holding of the fullness of one's humanity and can make possible therapeutic liberation and healing. Becoming aware, as I said, of perhaps our Judeo-Christian, capitalist, misogynistic rape culture and challenging how it too narrowly construes human nature and understands human beings and impacts people disproportionately. So for those of us who are cishet therapists in a cisnormative culture, as we all are, we want to analyze power and opportunity and responsibility. And that I cannot truly understand trans ways of being. So how can I provide the care they need? You know, these humanistic and existential and contemporary analytic ways of thinking and therapy itself has some answers, has some ways in. And I think that my work has been an attempt to formulate this respectful and accurate and comprehending of a phenomenology of transgender existence that I've often checked, that I receive the data in therapy sessions and check it out and explore it with folks. So we'll be talking some about that today as well. So just some memes here. This is part of the learning. Social media has been an important, I learned from trans kids and adolescents and adults that great solace and community was found online, right? It was through Discord and servers and chats and YouTubers and podcasters. And so as I got linked in via social media communities, similarly, around multiculturalism, around diversity, around oppression and social justice. That's where I kind of spend a fair amount of time outside, of my work, boosting the signals to folks that I'm in relationships with through social media. So here's Desiree Lynn Attaway, who's a very powerful and brilliant speaker and social justice advocate. So there's Desiree Lynn Attaway. Yeah, so because we start with our own cisgender worldview, we must intentionally get on the path of acceptance. The acceptance of transgender existence, of gender expansive existence, and understanding that and helping the parents of children and teens get there, helping teachers get there. And one more little snapshot there.
John, could I invite you to read them out loud for us too, just for if we have anyone that would be calling in, you might not have the visual.
Okay, thank you for that, Roxanne. Let me just blow it up here. It's a little small here on my screen. Okay, privilege isn't just about the things you were given, it's about the things you were never subjected to. And so we want to make sure that we're raising our own consciousness around our assumptions about how the world works and how it impacts us and others. Okay. And so we're talked about some of these existential and humanistic foundations of affirming therapy. And I'm going to share some of the patients' words. They've talked about the tragic existence of being transgender. Again, this is for folks who experience moderate to severe gender dysphoria. The pain of the incongruence, of the awareness of the incongruence. Some folks do not experience a great deal of it, and it's a bit of a controversy. Well, can a person be transgender if they don't have any dysphoria? And I would say, sure. They can have an awareness of the discrepancy, of the incongruence, and not be suffering in it. I'm sure that's a smaller percentage, but I'm talking about the folks, the last 8 years who have come to me have often been in moderate to severe distress and dysphoria. So for these folks, these are their words. That birth is a curse and existence is a prison. At times, right? Prior to emergence, prior to social transitioning and medical transitioning, this is sometimes their experience. And the transphobia they face, right? The denial of their agency and their right of authentic self-determination. Yeah, and the attack on trans people's bodily autonomy continues. The crisis of existence, that my body doesn't belong to me, yet I have to take care of it. Even though I hate it with every inch of my being, I'm working to erase myself sometimes. I wear baggy clothes so they can't see what shape I have to my body. The wish to just be comfortable in my own skin and not worry about it. And I think of this idea of transgender thrownness from a kind of existential perspective. This grieving the childhood or adolescence or life that they were not allowed to live, able to live. When they feel that the pain of that they will never be cis, that is often sometimes a wish that they have. All wish that they were not, often wish that they were not trans, that this is an uninvited tragic dilemma. And then the paradox of that is then once acceptance and emergence happens, right? And some initial transitioning happens, that there's such a relief of dysphoria. There can be transient, happiness and discovering, oh, that's a real high. That's what happiness is, which leads to other different connections. And then it often shifts to other dysphoric associations. So perhaps if someone's voice was either too high or too low, as they begin hormone replacement therapy and their voice shifts. It shifts with, for trans men who begin testosterone and their voice begins to deepen. Oh, they can begin to feel a sense of relief, but then it might shift to then their chest, and then the wish for chest masculinization surgery. And then so it shifts. So dysphoria and its associations can shift. And so therapy is part of working with and appreciating how their pain and suffering is evolving and shifting, and how we can help support them through letters of support, working with other professionals. So that in the midst of the tragedy at times, then there's gender euphoria, or a pink fog, an acceptance euphoria, and all the positive and growthful and energizing ways of being that happen as authenticity and a sense of their true gender self is integrated, and they look in the mirror, they see their true selves, and others are seeing it as well through the emergence process. Yeah. So let me move on. So, I actually want to go back a bit. For folks who, I've heard a lot of cis folks and parents say, as they're questioning, well, gosh, my child came out as trans non-binary, their friends are coming out, is this a fad? Why are there so many people coming out now? And of course, as we know, that folks of trans and gender expansive folks have existed throughout culture, throughout the world, around the globe for centuries. And just to kind of share just a few bits that are often pointed to. Around 5,000 to 3,000 BC, Gala, described as androgynous or trans priests of the Sumerian goddess Inanna, spoke their own dialect and took on feminine names. So they were androgynous or trans priests around 5,000 to 3,000 BC. And sometime from 200 to 300 BC in ancient Greece, some gods were worshipped by priests who wore feminine attire, identified as women, and have been therefore identified as scholars as early transgender figures. In the 4th century, Anastasia, the patrician, fled life in Constantinople, the capital of the Roman Empire, to spend the remainder of life dressed masculinely as a monk, and has become viewed by some scholars as transgender. In Southeast Asia, at least 8 known gender expansive identities have historically been present in the subcontinent. The most well-known being I'm going to butcher it, forgive me, I think it's the Hira, the third gender people of historical, spiritual, and cultural significance in South Asian society. Hira and individuals of diverse gender identities have been well documented in religious and cultural texts and legends, and these individuals often form intentional communities for community as well as survival. The oldest Western institute studying LGBTQ identities was started in Germany in 1919. It was called the Institute for Sex Research, and it performed some of the earliest contemporary affirming medical services. And it was eventually destroyed by the rise of German fascism under the Nazi Party. In Turtle Island, an indigenous name for North America, indigenous communities use the term Two-Spirit as a modern pan-indigenous umbrella identifier for people of another societal and ceremonial gender identity. This term was established around 1990 as a modern collective term for a historical gender identity, describing individuals not considered men or women in most, if not all, indigenous cultures of Turtle Island. And today, the Human Rights Campaign Foundation estimates that there are more than 2 million transgender people in the US, based on an analysis of the 2018 General Social Survey. And 1 in 5 adults in the US knows someone who uses non-binary pronouns other than he or she. So far from being a new phenomenon, transgender non-binary people have existed for centuries among cultures around the globe. And some of the newer terms you may hear patients and folks identifying with. And so gender denotes the public, usually legally recognized lived role as a boy or a girl, man or woman, and biological factors combined with social and psychological factors contribute to gender development. I don't know if I need to go through all of these, but these are things, again, you may hear and talk about. I'm happy to go over some of them as needed. Also want to, other terms that are used more so these days as well. And the term queer being used as an umbrella term. In the past, it's been used to kind of also include gender identity, sexual orientation, different cultural aspects of presentation. It's a very broad and inclusive term that a lot of younger folks I work with use, as they're journeying and questioning, as their sense of themselves is kind of flowing and being crystallized and flowing again, whether it's around sexual orientation, romantic attraction, gender identity. The term queer can feel more inclusive and encompassing. And in the last few years as well, we've seen more and more folks identifying as non-binary. And so we've been working hard to create support groups because they were finding that, hey, we don't really fit into the trans groups. We want to have our own groups, of course. And so we've been learning a lot more as they've been emerging, allowed to emerge, and having their voices boosted. And so just some information about non-binary folks. So most people, including most trans people, are, identify as male or female, but some people don't fit neatly into the categories of man or woman or male or female. So for example, some people have a gender that blends elements of being a man or a woman, or a gender that is different from either male or female. And some people don't identify with any gender, the term agender. And some people's gender changes over time. It flows. So people whose gender is not male or female use many different terms to describe themselves, with non-binary being the most common. And other terms include genderqueer, agender, bigender, two-spirit. None of these terms mean exactly the same thing, but all speak to an experience of gender that is not simply male or female. And so non-binary people aren't confused about their gender identity or following a new fad. These identities have been recognized, again, by millennia, by cultures and societies around the world. And not all non-binary people need medical transitioning to lead a fulfilling life, but it's critical and life-saving for many. And as we're appreciating the various spectrums of human traits, human diversity, a group that I didn't know much about, and we're beginning to now much more appreciate and amplify the voices, is of the intersex community as well. And so we'll talk about those folks as well. Intersex people, I've seen different estimates. They think it's between 1 in 1,000, or 1 in 1,200 to 1,500 to 1 in 2,000. So it is not, it's about the same amount of people who have red hair, is my understanding. And so intersex people have anatomy or genes that don't fit typical definitions of male or female. Most intersex people identify as either men or women. Non-binary people are usually not intersex. They're usually born with bodies that may fit typical definitions of male and female, but their innate gender identity is something other than male or female. And an interesting case study that came up on the World Professional Association for Transgender Health, an implication for a lot of cis-het therapists. And here's the case study that someone brought up. I worked with a non-binary patient for a mental health assessment for the first letter for genital surgery, for sexual confirmation or genital gender affirmation surgery. Forgive me. They were assigned male at birth. They presented in an androgynous manner and did not want breast growth, but did want a vulva and vagina. They now have the body they knew they needed and are on a hormone therapy regimen with their provider. I think it's critical in our field that our field understands that one's gender identity does not automatically give us information about their medical and surgical needs. That is a very endo-cisnormative perspective. So that's the term. It's endo-cisnormative, which is, well, if they're a woman, then of course they'll want a vulva and a vagina. This assumes anyone with a gender identity of woman wants to have an endosex cisgender body and is endo-cisnormative. We need to move away from that way of thinking to a more individualized approach that doesn't assume binary embodiment goals or any specific embodiment goals. We need to focus less on a person's gender identity and more on their embodiment goals in order to create person-centered medical plans. And it's that idea of, here it is. I think it's important that this approach is for everyone, regardless of identity, not just for non-binary patients. A binary trans woman has every right to feel comfortable with her natal genitalia and still be herself, a woman. As Dr. Joe Olson Kennedy says, we have to stop gendering things that do not innately have a gender, from hair length to clothes to jobs to genitals. She says, a penis is not a boy, it's a penis. Also, Kate Bornstein's famous quote, the plumbing works and so does the electricity, when speaking about why she was not seeking genital surgery. And I hope folks will take a pause to consider how they might be reinforcing endo-cisnormative embodiment ideas in their practice. And are you open to imagining possibilities of gender health outside of endosex cisgender normative bodies? Do you trust that each individual is the expert in their own experience and in their knowing of their experience of their body? And this is critical, I think, for cis people and for the parents of trans and non-binary children, adolescents. That's often what it comes down to. So when parents often contact me, to work with their children or adolescents, I put it right on my website, Affirming Therapy. And some folks, most parents are fine with it, but some folks are very suspicious about it because they wonder, essentially, how can their child know this? How can they know this? How could they know that they're trans? How can they know they're non-binary? How can they know they're, about their romantic or sexual attraction? Do you trust that each individual is the expert in their own experience and in their knowing of the experience of their body? And so, I love the reply of, we don't interrogate our cisgender children, do we? In fact, we say, oh, where's your boyfriend? Where's your girlfriend? We're assigning them romantic attraction or, partnerships. How come we don't interrogate cis kids? How do you know you're cis, right? So I believe, and again, we'll talk about when we talk about the diagnostic part, the doing a good diagnostic evaluation. We affirm their subjective knowing of themselves. It is self-report, and we look for I'll get into it now, I guess a bit. We listen for the trajectory, right? The developmental timeline, whatever it might be. And we listen for the, they call it the rhyme, the insistence, persistence, and consistency of their knowing of themselves, which doesn't mean that it's not going to flow and change at times, because it does. So we're going to be careful about that we're not gatekeeping in any way. So why don't I pause here and see if there are just some thoughts, and let me pull down. I see there's something in the chat. Okay. Good. Thank you for that, Jared. Yeah, about endocis normativity. And again, I'm also happy to kind of, as questions or comments come up, please feel free. And now I will move that. So, again, I have some different images that I thought were helpful for me. And so I thought, oh, this could be useful to share this information with colleagues. And of course, I'm still figuring out. Okay. So, right. So again, we think about the umbrella, and maybe this, again, some of these may be a bit out of date, so forgive it. But just kind of, again, open up kind of the sense of complexity around gender identity. And so we have some of those other terms on the right there. Gender fluid, bigender, agender, two-spirit is not there, but some folks refer to themselves as a demi-boy or demi-girl, genderqueer. And again, for us, it's, oh, tell me about that. I'm curious about it. What do you experience? And it's not how do you know in an interrogative way. It's, oh, what do you experience? It's held in that regard. And so with non-binary folks, it's very important that as people reveal their pronouns, these are, again, we're doing away with the term preferred. These are not people's preferred pronouns. These are their pronouns. And so they, them. I remember when this came around about a year ago, it was so great. There are some school kids on the table next to us at McDonald's practicing their friends' new they, them pronouns. If we practice now, then think how happy they'll be on Monday at school. My heart. And it's very moving. The younger generations are going to give us such hope. They don't have they were not indoctrinated and socialized into the binary of gender, into as much homophobia, transphobia, racism, misogyny. It's still prevalent, no doubt, but they are aware of it. They are speaking it. They are languaging it. It cannot operate outside of awareness and under the surface as much as it did. And so there's going to be a time for a lot of radical reckonings and hopefully healing and greater opportunities and protections and support. So pronouns, I mentioned that later too a little bit. And again, in appreciating the complexity and diversity of what it means to be human, cis and heterosexual therapists, we need to be really aware and appreciative and open to hearing about all sorts of aspects along the sexual orientation spectrum. And of course, my younger folks would also help me to know that there's also romantic attraction, which is different from sexual attraction. There are, that the diversity of human traits need to be embraced, and so we have I think you can all see the gender unicorn, sometimes a controversial figure. We've been expanding it ever since. Folks have been expanding it ever since. that gender identity and gender expression, sex assigned at birth, who one is physically attracted to, who one is emotionally attracted to. It's not, we don't have this kind of very flat, overly simplified way of thinking about folks across the various spectrums of their traits as a person. And as a lot of folks in the community will say, if you've met one trans person, you've met one trans person, right? I'm speaking in some regards with some generalities for the purpose of, showing some themes that might cluster around certain groups and certain folks, but again, always appreciating the unique experience of each person and where they flow on these different spectrums, where they flow. And important not to assume things. Oh, I would also add relationship constellation now too, as more folks are emerging and being accepted as polyamorous, open relationships, many different constellations of relating and loving, or for sexual desire and expression. I would include the kink and BDSM spectrums as well, and fetishes, all these aspects of sexuality. We need to have, and I would also add, of course, neurodiversity as another spectrum here, because what we find in our work is that there is a significant co-occurrence of gender expansiveness and neurodiversity. And so I know I'm asking you all to join in the calls. Well, I'm asking all of us to become much more skilled and knowledgeable about autism and gender diversity spectrum ways of being, around desire, around sexual orientations, around emotional connections, gender identity issues, endocrinology, right? So many more things. And I think this is what makes our roles as psychologists. It helps us to be more effective advocates, and it also helps us to be, I think, more knowledgeable and helps us to make larger contributions. And I think that helps to keep our work vital and have something to offer. And so let me just get this synced up here. Right. So something that happens a lot as folks emerge into their true gender self, and as that flows into more authentic ways of being, is that they find that they're, and of course through the use of hormone replacement therapy, and they feel more safely themselves, and they can express and reveal who they are. Sometimes that it deeply impacts their sexual fantasies. It impacts their sense of who they're attracted to, who they're sexually attracted to, emotionally attracted to. And we have to hold that space as well. As I said before, the different constellations of relationships as well. And so that may feel radical to some people. And so I hope this is an opportunity to begin to think about that. Okay. And so what I would recommend, there's controversy within the autistic community about Autism Speaks, a lot of criticism about how it's been viewed as, in some ways, a disease or a phenomenon to be treated and reversed. And the idea is that, no, this is a way of being that we need to appreciate and understand as neurotypical folks, and evolve institutions to meet their needs, their ways of being, their sensory needs, their even ways of engaging, communicating, and relating to folks on the autism spectrum. And so some of the groups that they would recommend, and I've participated with, is the Autism Self-Advocacy Network, and they have a publishing house, which is wonderful. So the Autism Self-Advocacy Network is great, and the hashtag #ActuallyAutistic, because what folks found is that it was a lot of parents of autistic people speaking. And so again, this is centering and focusing on the voices and experiences of autistic people themselves. So again, another important complexity of human being that we have to make sure we have safe, accepting, and caring and empowering therapy situations for. So we're going to go back to focusing here on what was first called gender identity disorder. First appeared as a diagnosis in the DSM-3 in 1980, where it appeared under psychosexual disorders. It was only used for the childhood diagnosis. Adolescents and adults received a diagnosis of transsexualism, homosexual, heterosexual, or asexual type. And then gender dysphoria, as we talked about. This is the thing I'm always thinking about. I'm always wanting to assess it in children and adolescents in particular. How are they suffering? Because it's often been private. It's often been silent. It's been a silent hell. I often talk to them about how I view them as super copers. There's got to be a better term, but to really attempt to empathize with folks who experience moderate to severe gender dysphoria, it's impossible for a cis person to know how persistently painful it must be. This is the distress that a person feels due to a mismatch between their gender identity, right, their personal sense of their own gender, and their sex assigned at birth. The diagnostic label, gender identity disorder, was used until 2013 with the release of the DSM-5. The condition was renamed, the way of being, I would say, was renamed to remove the stigma. They took out the word disorder. And so now it's gender, the diagnostic label is gender dysphoria. And I mentioned the rhyme, persistence, insistence, consistency, over months or years. But I must say, I work with some folks who it crystallized in their mind over a few months as a young adult or as an adult. And that is obviously equally as valid. According to the World Health Organization, which comprises of 194 countries, gender incongruence is going to be the new term starting next year, I believe. Gender incongruence is a medical condition and will be coded under sexual health in the ICD-11 2022. Gender incongruence, they're saying, is not a mental health condition. This is based on empirical evidence related to brain structures, at least 12 DNA markers, and hormone levels and receptivity, and more. So important diagnostic considerations, which, and again, and the labeling is so important because so many of the diagnostic labels have been not helpful and stigmatizing. Okay. So something that is really important to acknowledge is that APA has Division 44, which you should all join. We should all be joining, all be members, which used to be called, as Dr. Hendricks used to call, the alphabet soup. It used to be LGBTQ. And now it's gender diversity and sexual orientation, which is a great way to kind of distinguish what we're addressing at a given time. So Division 44 of the APA, and they have guidelines that are the best practices for psychological practice. I see the guidelines is there twice. I feel that strongly about it. I put in there twice for psychological practice with transgender and gender nonconforming people. And then they're referring it to throughout these standards, throughout these guidelines as TGNC. And so this is to assist psychologists in the provision of culturally competent, developmentally appropriate, and trans-affirmative psychological practice. And so I wanted to talk a little bit about this and also address intersectional identities here, because we know that close to 30 trans women of color that we know of are murdered in the US alone every year. And we know it's hundreds around the world. So not just affirming care is what we need, legal protection, safe spaces. As we work towards a more humane and just society, we need to take active steps in showing up, to advocate in as many places as we can to affirm transgender existence. And so I wanted to talk about some of these guidelines here. Of course, the first one, here it is, number one, right? Psychologists understand that gender is a non-binary construct that allows for a range of gender identities and that a person's gender identity may not align with sex assigned at birth. So we're affirming and acknowledging something that cis people have been privileged to never maybe even have to consider. You know, as I think back, you know, again, 10 years ago, maybe I should be ashamed or embarrassed to say, but I was blown, my mind was blown. Wait, that's possible? That happens, that occurs? So there's privilege to never having to know that this phenomenon and way of being exists. Guideline 2, psychologists understand that gender identity and sexual orientation are distinct but interrelated constructs. And as I said, it's something you want to be holding a space for and listening for with your patients, because sometimes young adults may talk about how, I thought I was gay, I thought I was lesbian, but then I realized, no, it was my gender identity that was really coming to the fore. And then it all gets kind of reworked. It all gets reintegrated over time. And psychologists seek to understand how gender identity intersects with other cultural identities of TGNC people. And there are some other things I wanted to bring up as well. And so I wanted to expand upon that third guideline here a bit. And so the rationale is that gender identity and gender expression may have profound intersections with other aspects of identity, right? These aspects include, and here it is, race, ethnicity, age, education, socioeconomic status, immigration status, occupation, disability status, HIV status, sexual orientation, relational status, religion, or spiritual affiliation. And so some of these aspects of identity may afford privilege. Others may create stigma and hinder empowerment. TGNC people who transition may not be prepared for changes in privilege or societal treatment based on gender identity and gender expression. So for example, an African-American trans man may gain male privilege, but will continue to face racism and societal stigma, particular to African-American men. An Asian American Pacific Islander trans woman may experience the benefit of being perceived as a transgender woman, but may also experience sexism, misogyny, and objectification, particular to Asian American and Pacific Islander cisgender women. And so the intersection of multiple identities within TGNC people's lives is complex and may obstruct or facilitate access to necessary support. TGNC people with less privilege and or multiple oppressed identities can experience greater stress and restricted access to resources. They may also develop, of course, resilience and strength in coping with disadvantages, or may locate community-based resources available to specific groups. So in practice, psychologists, what do, right? We strive to recognize the salient, multiple, and intersecting identities within TGNC folks that influence coping, discrimination, and resilience. Improved rapport and therapeutic alliance are likely to develop when psychologists avoid overemphasizing gender identity and gender expression when not directly relevant to TGNC people's needs and concerns. Even when gender identity is the main focus of care, psychologists are encouraged to understand that a person's experience of gender may also be shaped by other important aspects of identity. So good. So I wanted to emphasize the third guideline. And before we move on to the next one, I also wanted to discuss the sixth guideline, which is not here on the slide. Because many TGNC people experience anti-trans prejudice or discrimination, psychologists are encouraged, we must ensure that our work settings are welcome and respectful of TGNC people, and to be mindful of what they perceive as unwelcoming. So hopefully some of today gives you some little tidbits about educating ourselves about the many ways that cisgender privilege and anti-trans prejudice may be expressed. And we should solicit feedback from the patients we serve around this. For example, as a result, when TGNC people access various treatment settings and public spaces, they may experience less harm and disempowerment and pathologization, and thus will be more likely to avail themselves of resources and support. We're encouraged as psychologists to be proactive in considering how overt or subtle cues in their workplaces and other environments may affect the comfort and safety of our folks. And so that means, looking at your forms, looking at your forms to see if you have, do you have too narrow and too much of a binary indicator around gender, around sexual orientation, for example, the kind of materials you put out there, the kind of languaging. And so these are things that we're encouraged to make sure we're doing more and more around, so we're as welcoming and inclusive as possible. The other thing I'd want to invite you to do is to have some more training around writing the letters of support. And the letters of support often are around hormone replacement therapy and gender affirming surgeries. This is a service that I've provided for the last 8 years, and I'm part of a group that offers this free of charge to the community because of the idea of gatekeeping, right? That this has not been acknowledged as a medical condition, right? It's something that has had to been attested to by therapists, and so that means that it's possible we could come up with the result. Nope, you don't meet the criteria. You're not trans. You're not gender nonconform. Nope, I don't believe it. And then folks who are suffering go without the life affirming and changing and healing therapy and procedures that they need. And so these letters are really important. And there's been concern about if we perform these letters, does it take 1 session, 2 sessions, 3 sessions? And might you try to, and could there be some exploitation financially of people, again, who just want to be affirmed in their gender and get what the World Health Organization is now saying, and we know it to be true, is a medical, biological, a medical condition. And so it's something you can begin to think about in your practice as folks who might add that, or you might add 1 hour a week or a couple a month, providing pro bono letters of support. And so I think I'll just kind of give an example of one here. And so there's no identifying information that I would reveal, of course, but so the letters often talk about how, and these letters are according to the World Professional Association for Transgender Health Standards of Care. So glad I reminded to bring that up. And of course, Jared, you mentioned it in the chat. Make sure you to visit WPATH. Their standards of care are often form the foundation for these letters of support and have great templates. You can also look up Dr. Michael Hendricks. He has a great template that he wrote and has edited over the years for these letters of support. It's an immediate way that you can apply your evaluation skills and offer a much needed support. Right away. Oh, thank you. That's one way, writing letters of support is one way you can begin to expand your practice and make an immediate contribution to the community. Another thing is to attend school board meetings and to find out where they're at in terms of their offering. Here in Fairfax County, Virginia, Northern Virginia, we're just about 12 miles outside Washington, D.C. It's one of the larger school districts, Fairfax County, 190,000 students. And so it brings a lot of attention anytime they bring up what's called the family life education component of education, where there was debates where they're going to include information about LGBTQ people and ways of being. And luckily, the school board has always been 10-2, 11-1, or 12-0 on the right side of affirming care and support for LGBTQ kids. Every school now has the support, the pride programs, right? And in fact, and there are pride organizations related for the school district. And that's one of the organizations that I support as well, is Fairfax County Public School Pride. But the school board hearings and meetings, they get pretty intense. And then they got violent here in Loudoun County just a couple of weeks ago. And so you could offer services, pro bono groups, debriefs for people who are doing direct actions, who are taking on the power structures, supporting our activists. So I encourage that. PFLAG is a wonderful organization that has groups throughout your area. If you have expertise, you might facilitate a group there. If they don't have groups for teens, you might start one just for teens. And when I say support group, just a safe place for them to come together and talk about who they are and what they're about. If they want to celebrate aspects of their social and medical transitioning, or just be and know with other kids, really great. And I think what needs to happen as well is that the pride groups need to start in middle school, during puberty, as a lot of these questions and ways of being are emerging. And so there'll be pushback around that. And of course, information around gender should be taught in kindergarten, right? Or preschool, because we know that more and more kids will be authentically sharing either dysphoria or just incongruence, and having a space and a place for that to be held and understood and affirmed. This is a way to help undo a lot of the harm and damage that our culture has done. So those are some ways that I hope we'll be able to continue to support. Just a few more of these memes I've collected, memes or images I've collected over the years. Yeah, this is the kind of denial, right, of the existence of other people that is so painful, which is why names and pronouns are so important. So important. You know, as I often say, you know, that I share because I didn't come up with it, but that, you know, using correct pronouns is suicide prevention. You know, it's suicide prevention for kids and teenagers. There's a story of, you know, thinking about the harm that's been done in psychiatry and psychology. A woman in her late 70s came to me to talk about her daughter had just transitioned in her mid 50s. And as her daughter transitioned, the daughter's child came out as queer. And so the grandmother, who was in the office with me, was just in a state of abject grief and horror because she had taken her child, now in her mid 50s, to a psychiatrist in the 70s. And the psychiatrist went to the psychiatrist because she was caught repeatedly wearing her sister's clothes. And the psychiatrist said, "You've got to get him to stop doing that," right? And so this is the gatekeeping. This is the soul murder. This is the kind of awfulness that mental health professionals have contributed to based on their clinical theories and what they were told. All wrong, all bad, and the great harm has been done. And so, you know, it was very healing that 2 generations later, you know, that now there were people could emerge to be their true selves, be held and supported and loved. And I only met with this grandmother, you know, a couple times, but she was fully supportive of her trans daughter and her genderqueer grandchild. But it was a very poignant reminder of the harm that's been done. Let's see. Just a few more things. Yeah, so, you know, as this outsider perspective I have, you know, as a cis therapist supporting the trans community, gosh, you know, I've been, some of the various themes that have emerged that have helped to keep me, I think, empathic and sensitized and open and feeling with as much as I possibly can has been to appreciate the depths of gender dysphoria, the various ways that people cope, and the extreme limits of coping. You know, a significant percentage of the people I support will report experiences of dissociation, right, of numbing out. And sometimes it's related to then cutting and trying to reintegrate and trying to manage, you know, the painful numbing out and then the overwhelm of being in one's dysphoric experience. As I said, I call them super copers. There's got to be a better term, but what I mean when I say that is that from my perspective, these are folks who are coping at the absolute extreme of the capacity to cope, to the point where then suicide and death feels like a comforting release and relief. And so perhaps people who are tortured, people who have been absolutely, you know, soul murdered through violations and intrusions of their body and their, you know, and their sense of self. But this is, for some folks, this is, you know, a global everyday experience where just being seen by others and being and perceiving being seen as the wrong gender and you know, looking in the mirror and hating everything, having to shower in the dark because not wanting to be reminded of their bodies. Again, I'm giving the extreme aspects, but this is something that I think can really activate our sense of care and the desire to help and support, and to help, you know, help folks get on that path of acceptance around them as support, but then also their own emergence and then integrating as they're becoming and living their authentic true self held within an external supportive community. So just some comments here that I was musings over the years, that the gender identity as the force that guides gender diverse people towards authentic existence and being in the world, away from existential vacuum and hopelessness and death, and points one towards the desire for life and meaning and purpose and community and connection and love. And that trans existence is a developmental process, a complex maturational process of authentic self-realization. It can take years to crystallize into a dawning awareness through countless subtle or several integrating experiences. Yeah. Again, it's with great awe that that I have the opportunity to support folks who animate this way of being. So you have to forgive me. So because I work with a lot of teenagers, meme culture is upon me. I'm kind of a Luddite, I guess, when it comes to technology. So I've been only accused a couple times of being a boomer, which I really enjoy because I am not a boomer. Gen X, thank you. But I enjoy being treated as if I'm ancient, because to them I am. But they often bring out different ways to share their experience through memes. And so as you all who work with adolescents know, invite it all. Oh, what games are you playing? What YouTubers, who do you like? And what do you like about them? And you might even then in some of your time go and visit those sites and see what it, not that you have to appreciate it in the same way, but understand what it is that is speaking to their experience. And there's very quickly changing and evolving names and labels and categories and controversies. And so everything has changed in the last 7-8 years since I've been supporting the community. Excuse me. So there's a nice visionary, visual example. I always was who I am, even if it took a little while to figure it out. And for some people, that's their journey. For some people, they know from when they're little. I know some kids. It's funny, starting out in play therapy, when I first, in kind of, symbolic experiential work for, with mostly cis het kids, or so I assumed. So when I guess they were 8 or 9 at the time, showed up in my office, I was, okay, play therapy. Maybe they're at the end of play age, but okay, here's this kid sat down and was like, I know what I need. I need a letter. I need a letter for a hormone, for puberty blocker. I want it. You're going to give it to me. And it's like, we're not doing play therapy. So not that trans and gender expansive kids won't play, but the younger adults will show up, or the late adolescent, late childhood kids are going to show up and be like, hey, oh, you're the therapist who's going to help me? Here's how you're going to help me. And I really, once they felt trusting, in some ways that happens too. But in this case, this one kid was just right at it and very helpful. And I said, well, we're going to get you what you need. Let's hear all about it. Let's see, how are we doing with time? So over the course of, listening and assessing, if you will, different ways of being in terms of gender expansive ways of being, it shows up in people's dreams. It shows up in their wishes, right? It shows up throughout their childhood. That folks dream. They dream, and in their dreams, they're often their wished for gender, right? It's the wish fulfillment of wish fulfillments, where people talk about their wishes that when they were little, they prayed, right? Prayed to be cis, to have to wake up and be magically, the body and person they know themselves to be. And that's why often working with kids and teenagers, video games, right? I often ask, oh, in your video games, what are your avatars? And they often say, my true gender self is the avatar. And that's what it feels so great. Or their online presence. They transition in their online presence. They emerge as their true gender self online. And that's often the first place they do it. And of course, they often tell their friends and get support from their friends first. And so when parents come to me and they may feel a little, all their friends knew about it first. And I say, yeah, every single one, because they found their group of people who are questioning and supporting each other. And I said, we're always the last to know, and that's fine. But now that we know, let's do everything we can to get them on the path that they need to minimize the dysphoria. So here's a little example of a young child who, through their kind of play expressions, showed up as their true gender self. And why don't we so if we could pause again I'd appreciate that. Thank you. Main goal for parents. Oh, thank you. The main goal for working with parents whose children are emerging and questioning is to get them on the path of acceptance, right? That this is real, that this is valid, that these questions are incredibly meaningful and essential to who their child is or the young adult is. That again, as I said before, that this is a way of being, that as cis people, they might have thought, wait a second, you are your body. How could there be a disconnection? Or how could there be a mismatch, an incongruence? It happens. It happens. And we're grateful when the kids can tell us. But, and so part of working with parents, borrowing from psychodynamic evaluations, right? Some of they would say, well, deciding if you're going to take on a case, do the parents acknowledge the child is separate from them, as a separate person? And do they acknowledge that their child is suffering? So I've always borrowed that one. Do they acknowledge that the child is suffering? And because that's the thing, it's often been invisible. It's often showing up as withdrawal, depression, anxiety, OCD, executive functioning. And again, and to the extent there may be neurodiverse features as well, it can be a complex picture. But when these questions come up, again, I would say they are valid and essential and meaningful in their own right. And in some ways, maybe drawing a lot of energy away from other coping capacities. And I'm, it's important. I don't want to say that when people emerge, I alluded to before, from gender dysphoria to euphoria, and then integrating the euphoric into just a sense of well-being, it does seem to decrease a lot of anxiety and depression and self-harm. And so not a cure, but it is certainly on the road to great healing. So I always try to, so if sometimes the kids will come, the teenagers or children will come and the parents don't. And I end up then saying, I got to make sure your parents know where you're at and just how important this is. And so I do a hybrid. Sometimes I meet everyone together. Sometimes it's just the parents, the old analytic idea of treatment via the parent, where there are some children and teenagers who are like, I do not need a therapist. I don't want a therapist. Good. But we still need to advocate for them. And that means then I work directly with the parents and get them on board. And so part of the dynamics that, of course, no child or teen wants to hear is that, that their parents are experiencing a sense of grief and loss, right? That they were already dreaming and imagining who their children were going to be before they were born, right? Before they were conceived, maybe. And so the child's born, oh, this is going to be great. I know who they are. They're a girl, they're a boy. And then they emerge. You're not who I thought I'm not who you thought I was. And there's, just tremendous grief and confusion and anger. And so, to the extent we can educate them, to the extent we can hold their grief and help them to face it, help them to face the reality of this questioning and this emergence and what it means. And again, so direct advocacy work for the child or teen through the parent is very important. So when the parent says, well, I'm grieving, and the kid's like, I've always been here. my true gender, who I am, has always been here, just in different appearance, different presentation. I'm not dying is what they'll say. I'm not dead. I'm not going away. I'm becoming the person I've ultimately always known myself to be. And so it's these kinds of conversations and dialogues that often, come up. So an important part, if you're going to work with, and as you know, working with children and adolescents, working with the parents and the family dynamics is critical and key. Let's see. So another kind of idea that came up for me, I'm gonna mess it up again. As I thought about developmentally, about the meaning of the emergence of transgender ways of being, and then as it shows up in the therapy room. We talk about the golden rules, right? The golden rule for your patients is please try to say whatever comes to your mind, with not limiting yourself at all. And our golden rule, no judgment, right? Person-centered. I think about attachments therapy, attachment to self, how attachments may have been experienced. In the fact that a lot of, trans folks have not had a lot of their life looking in the mirror and seeing their true self. That in some ways, when they come to us in an affirming therapy, we're saying, I see you. I see your true self, even before any kind of social transitioning, even before, any kind of medical transitioning. It's important to hold that with them, that you see and know who they are, because they're telling you who they are. And so these kinds of peaks and valleys that happen over therapy with adults, of kind of gender euphoria and dysphoria, as folks have talked about, that they're getting closer to how I wish to be seen, I'm getting correctly identified and gendered by others, and then they internalize and take that in. It brings to mind, to me, this idea of the mother-infant dialogue, right? That the attachment theorists talk about, and how that is internalized in a lot of ways, right? That I see you, you exist, you're safe, I love you, everything, your needs can be met and known. In some ways, it seems like that in kind of longer term, process-oriented and humanistic existential therapy with the adults who have emerged and are transitioning, I think we recreated, and maybe that's in all therapy, maybe that's nothing new, but that we're recreating this kind of dialogue of being, but I think it's more significant and important here, right? We are really seeing the person in a way that they've not been seen before, and that is an ecstatic experience, right? That is because that holds the hope of the possibility of that they can be their true self and be loved, and in and of themselves. Not, so the idea of I see you, you exist, you are loved, you deserve to be yourself and to be here in the world. I think that in and of itself is a profound underlying affirming dynamic that we can animate with our patients. Let's see if there's something here that we could, oops. As I talked before, always tuning into the invisible suffering. And again, a lot of patients might say like, it's fine, I'm fine. Oh, well, how does it feel? Oh, I don't do feelings. That's too much. I can't, that's too much. Okay. So we have to appreciate how people are coping, right? And then see if we can help them to broaden and deepen their appreciation of how they're coping, and see if we can help them create conditions where they feel a little more open to varying their ways of being in the world. Yeah, so these are just some of the quotes that I've heard over the years, around the gender dysphoric existence. It's a fight you can't win. It's eating me alive all day. I'm missing a part of my body that I'm supposed to have. The person talked about phantom dick. Sometimes you look down and it's not there, and it's confusing. And on hormones, right? So finally, here's the beginnings of medical transitioning. I'm not in a constant war with myself, that the dysphoria was a weight, that it just feels right. And that word often comes up. It just feels right. It just feels correct. I'm correct now in a way that I wasn't. Yeah. And that HRT, some people talk about the experience of, in this case, trans women having estrogen and the various other hormones, that as testosterone was draining, it felt like it was a toxic chemical. It felt like a toxic chemical. And so then I wondered, are trans and gender expansive folks sometimes in a biological state of deprivation and starvation, and then how they experience that and how they articulate that, right? So again, really trying to have as compassionate and empathic an appreciation for a way of being that, if we're cis, we can only try to help create a caring environment around. And I said, right, there is a cure, right? We wish, but there are things that can cure some of the severity. Yeah. Also about gender dysphoric existence, that there's often a breaking point that some people experience, right? That at some point they think I have to transition or I'm going to die. And for a lot of the adults I work with, because they've grappled with it for decades. So when I first started working here with the community, it was a lot of trans women in their 50s and 60s. So they had coped, they came to the area, they were working in government service, military service, they married, had children, maybe they cross-dressed on the weekends. That was the kind of the closest they could get to experiencing their true gender self, or did it secretly or at different clubs or safe spaces. Decades of coping, decades of suppression and associated depression and anxiety and self-harming and all sorts of things. But then at one point, typically, sometimes it was then, oh, I retired, now I can begin the transition, it's time. But for some folks, the coping was, I have to emerge and transition or I'm going to die. And so like a lot of folks who have lived with an abject sense of hopelessness, they can scarcely believe it's happening, right? I work with some folks who they transitioned 4 or 5 years ago. Like, I still can't believe I did it. I still can't believe it happened. I have to now envision the rest of my life because I didn't think I was going to be around this long. I didn't think I was going to be able to cope. So, so just to kind of give you a sense of the depths of the pain that we're being called to be stewards and helpers for. So we're going to go blow through some of these here. As one young patient said to me, get your pronouns correct. That shit matters. And then APA got on board with the singular they pronoun endorsed, which of course we do all the time anyway. So everyone stop being big babies about it. Thank you. Birth name and chosen name, right? Get on board. Some people, some parents have trouble getting on board and they will out their children and young adults in public because, and some kids will out their parents if the parents have transitioned, if they're not, being helped to use the correct name and pronouns. So, let's move into how therapists can help. And we talked about this. Become aware of Division 44 in their journal. Please join. Check out WPATH, and their membership and their training offerings, and immerse into the culture, immerse into queer culture. Don't center yourself in it and your voice in it. Hang back and learn and grow and find opportunities to support in ways that feel right and welcome. The activism is needed because the hate groups and groups who would seek to gatekeep and obliterate and annihilate diversity of the human being when it comes to gender identity, sexual orientation, they're out there, and we know who they're getting stirred up by. We know the culprits of Fox News and certain Republican extremists. We know who these people are, and religious organizations, right? Here at the school board meetings, the people are bussed in who are sponsored by hate groups to make big scenes. So we need to show up and show the kids who are most impacted that they are loved and supported and protected. Okay. Ooh. Nope. There it is. Nope. Hope for the future. As I said, our younger generations, well, and that has a lot to do with the parents. Hey, a lot of parents raised a lot of kids with a lot of love and a lot of hope, a lot of love, a lot of acceptance, right? They didn't teach hatred. They didn't teach discrimination as much. And maybe also just the access to all this knowledge and information through social media and the internet. It's one of the positive aspects. The internet has saved thousands of trans and LGBTQ lives for its connecting ability, right? People could find community in the distance, even if their home, even if their community, their city, their area was not safe. They could have lifelines to people. So a lot of good information is out there, as well as questionable stuff. But so yeah, same with peers, right? They have their peers. They have the GSAs. That's what I couldn't think of earlier. The Gay Straight Alliance or Gender Sexuality Alliances, pride groups, right? These are lifelines. These are so important and so life-saving. And more colleges, that's right, are really advertising what their LGBTQ accommodations are in terms of housing, peer support groups, community events, programming, and certain health plans will cover all medical transitioning related costs. Not as many as we need, obviously, but that is huge too. So if kids have to wait until college to transition and emerge, they can do it. So that is important. So if you're working with young adults, you can, and they're looking at colleges, of course, see where they rank in terms of LGBTQ, or I think it's a pride support listing. You know, I've been working in the field for about 24 years now, just over half my life. And, you know, and it's been really satisfying and fascinating to look at the kinds of presenting problems of referrals. You know, you're like, oh, anyone do play therapy with a kid who's got some anxiety? Okay, sure. So I love this. Hello. This is a referral. I met a lovely person today who, while a good fit, is nervous about the hour commute to my office. I told them I'd give them my best shot at finding them closer to their school. They're non-binary, demisexual, autistic, and questioning poly, but mainly wants help managing anxiety and navigating shifting identities. It is most important to them that they have a queer identifying or friendly therapist with morning availability and flexes with autistic needs. Ideally, this person would like a therapist taking a Blue Cross Blue Shield and sliding scale. Exactly. It's a tall order, but I promised I'd run it up the flagpole, right? And so more and more referrals really talk about the intersectional identities, really talk about the depth and complexity of what it means to be a young person, particularly. Not that us older folks can't also identify throughout these various aspects of self, but we often didn't have the languaging, right? And didn't have the level of acceptance. So working with teenagers and young adults, here's the various things we want to develop competency in, and then we can offer that to the community. And here is a true God among men, Don Cheadle, of course. When he wore this, I think it was about a year and a half ago, if not 2 years ago, on Saturday Night Live, it was a big deal. It was a huge moment for trans folks. And we had fundraisers. We were selling the shirts to raise money for Fairfax County Public School Pride. And so, you know, more and more a vocal support, because unfortunately, you know, what I've said, maybe incorrectly, to a lot of folks the last 7-8 years, to parents who are scared about their kids and their well-being and their safety, I say there's never been a better time for your child to emerge. There's more knowledge, there's more protections, there's more, the institutions are shifting. Hospitals are shifting. They can have their name listed in their school rosters, you know, their chosen name. Many more doctors and medical facilities are all much more trans welcoming and competent. Not all the office staff gets it right, and that is unfortunate when there's turnover. And so whether it's at the endocrinologist office or a certain medical office, sometimes then dead naming can occur, and it's awful. But more and more safety, protection, support, community, more and more therapists who are going to be able to offer affirming therapy are happening. So never been a better time to come out, a better time than maybe in all of human history. And yet, because it's really flowing through our culture at this point, there's a lot of backlash, right? And we see that with the bills that are being, you know, every year now, the Republicans put about 80 to 100 bills out. The most recent ones were 2 years ago was the trans bathroom bills, you'll remember. And now it was trans girls in sports, of which there were like, you know, 3 or 4 that they were really citing. So yes, there is the greater backlash. There is a need for protection, of course, and yet there's also more and more safe spaces for people to emerge. And along that, I will just kind of flow through some of these. Right, that there's also a Trans Day of Visibility every year. Many active efforts across the country to legislate trans and gender diverse people out of existence, and we beat them back. So of those 80 to 100 bills, most of them get defeated, right? Most of them do get defeated because we are aware, we see them coming down the pike, we know what's coming, we know how to fight them, we advocate against them. Yeah, so this is from, again, a couple years ago. Transgender people are people, not a political stance, not an ideology, not an agenda, human beings across a spectrum of beliefs and experiences. There's no such thing as I don't agree with transgender. We are a group of people that exist. Our existence isn't a question. And with regards to the bathroom bills and that battleground of bathrooms, don't hear about it too much these days, maybe. But do you know who gets harassed and assaulted in bathrooms? Trans people who just want to pee. You know, there have been 0 incidents of the man in a dress creeping on young or adolescent girls, which is the narrative that's often brought up. It's a lie and fear-mongering propaganda by hateful, uneducated, scared people, seized upon by conservative politicians as part of whipping up fear of the other, right? And why? For power, you know, for votes and money at the collection plate. They need enemies to affirm one's specialness. And so I don't have small feelings about that. But that was a great sign from the city of Bothell in Washington State. There's room for you and room for him, room for her and room for them, room for young, room for old, room for shy, room for bold, room for, this is like Dr. Seuss, room for short and room for tall. Tell me, how is there room at all? Room for all. Here is the secret to making rooms great. We refuse to ever make room for hate. Yeah. And just to always bring up, you know, just as we think we're making progress, this from maybe about 1.5 years ago, you know, every day online, right? There's transphobic posts throughout the world, and that shit hurts, right? That hurts our children, young adults, and adults who are gender expansive and trans. But it gets better. It is getting better. All right, San Francisco lighting up City Hall with their trans flag. More and more places for trans folks to share their experiences of grief and loss about the childhoods they wish they had, so healing can happen. Again, this is a little while ago, but my hometown of Philadelphia, Mayor Kinney signed laws to protect the rights of transgender, non-binary Philadelphians. More and more inclusivity around driver's licenses. Now gender X will be included. And then finally, well, let me do it, right? That there's a transgender day of visibility to celebrate trans loved ones today and every day, of course. And then every November, there is the Transgender Day of Remembrance. Again, for people who have not been grieved, or when they died and their dead name was used, or they were buried in the gender that they were born with and not their true gender. And so sometimes it's the only time and only place that a person is grieved in their true self. And again, every year, over 30 transgender women of color brutally murdered in the country. Again, often buried by their families with their birth name and pronouns and erasing their true selves. And this is a day to speak their chosen names and honor their chosen existence, of their authentic existence. And again, maybe the only ceremony where their true identity is affirmed and mourned. So, so thank you for your time, your patience, your openness. If you're here, you're already making an important shift in consciousness and awareness. And humanistic psychology has so much to offer, baked right into our notions of what helps people to heal and to grow, to become authentic. These can be directly and if carefully applied to transgender, non-binary, gender expansive folks. And I look forward to learning more about how you've already been doing all this great work or how you'd like to continue to do it. And thank you. I see we have one question from Jared. Yeah, do you think humanistic psychology should have a voice in the debate about rapid onset, right? I see more and more organizations within and outside APA. Great. Yeah, absolutely. Absolutely. And as you said, and please let's talk, or please feel free to move forward with that. Yeah. The idea that we can't trust what a child or young adult is telling us. This just happened. They just came out. How can this be true? Right. So yes, all the various theories that have been brought up to try to counter authentic trans experiences and ways of being have to be countered and should happen at the level of APA. Perhaps, Jared, I don't know if 39 is already working on something similar, or that would be a good way for us to partner up with them. So great question. Thank you for that. So yes, so
Sean, I want to just jump in for a second here, if you don't
Please.
mind, and just thank you on behalf of the virtual conference for gifting us your time today and this amazing presentation. If you have the ability, we could open it up to questions and answers. People are more than welcome to open up their mics or their cameras. What I'm going to do is get the information for the CEs typed
Great.
up into the chat below. And I'm going to turn off the recording, so if people have questions that they wanted to kind of have attended to, they can do that just within the people in the session. Okay, does that sound fine?
Really great. Thank you so much, Roxanne.
Thank you so much. Unbelievably grateful for you, Sean.